A further 3 cases of coronavirus have been confirmed in New South Wales. In an alarming and distressing turn, the state's first cases of human-to-human transmission have been recorded. This comes as the federal government advised all health and aged care workers returning from hotspots to self-isolate for 14 days.
The coronavirus is spreading quickly and dangerously across the country. In New South Wales, 2 cases of human-to-human transmission have been confirmed. A 43-year-old woman has contracted the virus from her brother, an Iranian man who arrived in Sydney 2 weeks ago.
The particularly challenging aspect of that and concerning to us is that she has not travelled to Iran. So it would appear that there's at least a high likelihood of transmission here in New South Wales.
He's in isolation at Westmead Hospital in Sydney's west. But what's of most concern to health authorities is the second case. A 53-year-old health worker is in the ICU after testing positive to COVID-19.
Our key focus at the moment is to contact staff or patients that may have been close contacts of this gentleman and do the precautionary things in accordance with the national guidelines.
More than 3,000 people have been tested for the virus in New South Wales alone. The New South Wales Health Minister is advising people to avoid shaking hands and kissing and insists the spread of the virus is manageable. Community spread is expected nationwide within 3 to 6 months. There are now 7 confirmed cases in Australia linked to Iran.
So in the case of Iran, there's such a high risk that a travel ban is worth doing because it will slow down the number of cases.
Iran isn't the only major concern outside China. The health minister announcing updated travel advice for Italy and South Korea.
Significantly, as well, the Chief Health and Medical Officers have recommended that if you are returning from Italy or South Korea and you work as a healthcare worker or as a residential aged care worker, you should not attend your regular work for 14 days. And so that's an additional level of protection which has been advised by the Chief Health and Medical Officers and accepted by the Australian Government.
78-year-old Perth man James Kwan became the first Australian to die from the virus on Sunday. He was evacuated from the Diamond Princess cruise ship along with 163 other Australians. Stella Todorovic, Sky News.